Hello and a very good evening, everyone. I'm Rita. Welcome to this edition of ITV Gold COVID-19 updates and info. Today we have the honor and privilege of having with us via Skype, who's currently, as we take him live on the show, traveling through the roads here in New York City. We have joined hereby with us Brooklyn Borough President, Mr. Erik Adams. Thank you so much for being with us here on ITV Gold via Skype. Thank you so much.
Thank you. Thank you for allowing me to speak with you as we move around and deal with this very serious issue of coronavirus.
Yes, for sure. And thank you again so much. I know you're currently on the road, and I think it's truly an exciting experience for us to have, this conversation go live while you're actually on the road. If I could ask you where you're headed to and how your day has been, could you give us a little insight into it, sir?
It's extremely a high level of stress on many levels. And think about it. New York City has never really had to deal with a crisis of this magnitude. The closest we can think about was after the 9/11 attacks. But after those attacks, 9/12, we were able to rebuild. But coronavirus is something that you're not rebuilding one day. Once you get your wind knocked out of you, you don't have a quick recovery. This may be here for several months, and we must get the right supplies and tools to our extremely stressed out medical system here in New York City.
Right, definitely. And it's right that you said that PPE, the personal protective equipment has been such a huge issue. It is one of the main factors that is truly concerning healthcare professionals and elected officials such as yourself. Today, you addressed the New York City Department of Correction, asking for, the workers there as well as the inmates to be protected better. I just want to start this off asking you how that address was and a little bit more insight into it.
Well, it's important that not only the prisoners receive testing and personal protection equipment, but also the countless number of correction officers, our police officers, our firefighters, all essential employees that will allow this city to continue to function through this crisis. They must be protected also. Unlike the September 11th attack, where many police officers received 9/11 related injuries, they didn't take those injuries home to their families. With coronavirus, if you are infected, you're going home and you could have long-term impacts on your families. As a former police officer, I know what that means. I know that we're starting to lose far too many people. We must isolate, contain, and give the proper protection equipment to those that we have placed on the front line.
So what are the demands right now, sir, if I was to ask you from the Department of Correction, what are you hoping to get for these inmates and also the workers that are working there?
We want them to have personal protection equipment. This allows the virus not to spread, and also it ensures that we are not putting people in harm's way. And it goes beyond the walls of our correctional facilities. It must be an immediate response from our entire city to protect those we're telling that they must go to their place of employment to keep the city running. Those are train operators, bus drivers, grocery clerks. All of these people who have stated they are willing to sacrifice their lives to protect us and to serve us. We must make sure they have the items they need to protect their families and protect themselves individually.
Definitely, and I truly appreciate you for bringing forward this really important topic, PPE. We are discussing this with everyone. I want to address, the medical community here with you, sir, and also all of the healthcare workers. Again, PPE is a huge issue for them as well. We actually had a doctor come and address the fact that she hasn't had a proper mask for 5 days, and she's reusing it because that's the only thing that she can do. And she is located in New York City. Your address to the medical community, the professionals, what insight could you give us in terms of what is being done by the borough office right now for these, healthcare workers and the medical workers?
It is the job of the city and state to get the equipment to them. I am in my car right now, and I'm going to show you a picture. These are boxes of masks that I just picked up and collected. I'm driving around to hospitals to deliver them to nurses and other medical staff. This is an indictment on our country on a whole, that the richest country on the planet, we don't have basic supplies for our healthcare employees. This is really an embarrassment for America, an embarrassment for New York State and New York City. We should be able to provide our citizens with the equipment that they needed. I should not be driving around the city, giving out personal protection equipment to our healthcare professionals in the most affluent country on the globe, in the most affluent city.
So I have to ask you, I know you have visited certain locations, you have visited emergency rooms, you're currently going and you are delivering PPEs yourself. This is absolutely amazing. Could you tell us a little bit more information about what is happening on the scene and how important it is for you to right now go and deliver these? A little bit insight into these doctors, these professionals, and what's happening on these emergency rooms that we keep on hearing about is like a war zone.
Yes, it is. It is the war zone. It's the war zone in America, and as in any war, there's a front. The New York City is the front, and Brooklyn is ground zero of that front. We're the epicenter of this serious issue, and as we are at war, you will not send your men and women into battle without the proper equipment to protect the country, and we're doing that now. And those of us who feel that we have an obligation and responsibility, we're going to the front line. We're on the front giving these supplies. These boxes here with me in the car, they're real, they're resources, just as any military person will be relieved when they know that bullets are coming to them so they can protect the country. When I bring these masks to our frontline people, they're saying that they know help is on the way. These are real boxes. I have 6 or 7 boxes here in the car with me that are masks that our nurses and hospital staff could use, because this is a very serious issue and we have to take it in a very serious manner.
And sir, how were these equipments that you're traveling with right now received to your office?
Volunteers and donation. People have donated masks to us. We have everyday New Yorkers who have reached out to contacts and were able to get these PPEs. Some doctor's office who had boxes or a box or two, we collected from them. Other dentist office who may have a box or two. Some private practices that have closed down, they have given us a box. So we've moved around the borough in the city and collected boxes so we could get beyond the bureaucracy and go right to the ground, to the hospitals, and give it to the people in need.
Wow, and I think that's absolutely fantastic. You know, this sort of brings me into a more interesting topic, just something a little bit more on the official side of it here. You know, I know you have called upon the local and state governments to support Brooklyn even more during this crisis. Brooklyn is an epicenter. We're here in Queens. We're not too far. We're all in the same situation here. Could you give us an insight into your communication with local and state governments, and what is your greatest need of the hour right now while you are traveling again on the road delivering the PPP?
You know, keep in mind, New York City has 5 municipalities. One of them is Brooklyn. Brooklyn is the largest of the 5 with 2.6 million people. If it was a separate city, it would be the 3rd largest city in America. And we are extremely diverse, with 47% of the people speak a language other than English at home. So we have to communicate with people in their language they understand, and we have to get the resources to people, because we have to fight this battle on 2 fronts. One, we have to fight it inside our medical facilities to make sure we assist those people who are in need of emergency care. But we also have to prevent the feeding of this crisis by educating, communicating, and giving assistance to people who are inside the borough. If not, we're going to have a continuous flow of people who are going to receive the virus and always be in a crisis mode. You cannot defeat this virus by being in a crisis mode. You have to stop some of the crisis from occurring in the first place.
You know, so you brought up an excellent point, which is Brooklyn is one of the most diverse boroughs of New York City. A lot of our South Asian community also lives there. A lot of minority communities live there. Right now, they're really concerned, especially for the members of the community that are at high risk. They do not know if they should step out or not. They do not know what protocol at times to follow. What is your comment to our concerned South Asian American community and other minority communities?
Brooklyn has a large South Asian population, a population that I know extremely well, and we're going to continue to partner with them to address specifically their communities, because it's a unique perspective here in a borough like Brooklyn, where we have a large emerging immigrant population.
Right.
It is imperative that as we communicate how to prevent the virus, how to address the virus, we have to do it in the many languages that actually are in Brooklyn. We can't think that the only individuals that need to understand what is happening with this virus are English speakers. Not
Right.
everyone listens to the governor or the mayor's communication. Not everyone speaks English. We need to communicate and reach people where they are and speak on the language and the cultural norms of the diversity of the city. America is a melting pot of different cultures, different groups, and different ethnicities. And as we talk about this emergency, we need to always keep that in mind.
Definitely, sir. I want to keep on continuing this interview and ask you another question in regards to what's happening with COVID-19. My next question is definitely has to do with all the information we keep on hearing about hospitals, the pop-up hospitals. Javis Center is currently getting ready to have, beds set up there. We're looking at New York, coming up to its capacity in hospitals. Could you reflect upon what is happening in terms of the hospital scene? And is Brooklyn also facing overcapacity of hospitals very soon?
Yes, we are clearly at full capacity. Many of our facilities, they have built additional spaces outside. We see that eventually we're going to have to put patients in tents set up. Some of our top hospitals in the city, they have already built additional space and beds. There are conversations about turning our hotels into hospital, makeshift emergency hospitals. We're building out potentially our cruise terminals, our different places where we hold conventions. All of these spaces are starting to be in use. One hospital in Brooklyn is using a military-style tent to hold the spillover of beds. We're changing the format of our emergency rooms. Our ICUs, they are also being reformatted. So we are at full capacity. And remember, we are not even in the eye of the storm. We're just at the tip of the storm, and we know that we have to buckle down because we're about to get hit with the real eye of the storm.
Yes, sir. And for the peak of this the storm, as we're talking about, they're saying somewhere in mid-April, we are trying to see the peak of this virus, and it's also been communicated via the administration. Any information on when you see the peak happening, especially in Brooklyn?
We don't know when it's going to happen, and I think any prediction that is being made, people are having their best educated guess. We are in uncharted waters, and the only way you're going to be able to navigate uncharted waters is to be as prepared as possible. I believe the city and the state needs to have on hand millions of various forms of personal protection equipment. We need to have a large stockade of food, supplies, all the things that we need. It's time now to get ready as we move into what many believe will be the most dangerous part of this virus.
Yes, definitely. And again, I'm sure you are communicating the message of social distancing, and we want to let everyone also know this. A quick question in regards to the U.S. Navy that has arrived, at the New York Harbor just 2 days ago. Could we get more information into their particular role in terms of the hospital setups, and has any communication happened with your office in terms of the ship that just arrived 2 days ago?
No, we have not had any update on the best utilization for the ship. Of my understanding, it's going to be used for non-COVID virus type cases. And so we will get a better briefing in the days to come. We thank the Navy for being here. And it's about, this is what we need at this time. We need an accumulation of all of our resources coming together.
Sir, FEMA has been called, and the federal government is such a huge part of it. How important is the role of military going to be in combating this virus? At the end of the day, when we are talking about pop-up hospitals, we're talking about more beds, more ventilators, more N95 masks. Your comments on that?
The military is important. We have here in America something called the National Guard. It is the civilian type military. Other people may define it as a militia, but it is the different parts of the civilian population that's in the military. They are now mobilized here in the city. You don't see a full presence of them because we're not at that level yet, but they are within reach if the governor or the president decides to deploy them to full capacity.
Is that something that the civilian living here has to be concerned about? That's a question that we
Not,
keep on getting about deployments of, the National Guard here on the streets of New York.
no, not at all. The role of the National Guard can be anything from helping move traffic to assisting and knocking on doors to check on people. It is a civilian approach to the military. It is not a full mobilization of armed forces. They're not going to be used at this time for law enforcement purposes. We have an excellent police force, and we're going to be making some additional calls on how to better utilize that police force. But people should not be worried at all that the National Guard is going to turn the city into a military state.
I truly appreciate that, sir. We're getting a question in coming from Facebook. I'm not sure if you were able to answer this, but I'll go ahead and ask this. My team just provided me this question. We just hear via our social media that the FBI has raided in New York, Brooklyn area. N95 masks were stored at a place for resale. Has your team been aware about it?
No more than the news reports. We were told that a person was hoarding a large number of N95 masks. And we need to be clear that while many of us see crises, some people see currency. They do price gouging. They attempt to charge higher prices for items. My office was able to partner with another local elected, and we identified a store that was price gouging. We want stronger laws to prevent price gouging during this time, because we don't want to turn basic supplies into those who are financially capable of paying for them and ignore those who are in need. And that is why we're going to ensure to pursue anyone who attempts to hoard items or to anyway try to charge a higher than normal price for the particular items that are needed at this time.
Yes, sir. And sir, is there a reason why we're seeing so much price gouging everywhere, not just in this state, but even in different states? Your comment on what's happening with this entire price gouging issue?
Well, it's unfortunate, but some people believe that this is a time for human greed and not a time for human need, as Malcolm Gandhi was saying. We believe that now is the time to show the best side of us as human beings, and we need to pursue those who are not willing to do that.
Sir, you just were talking about a crisis, and you were talking about how some people take it as greed. It sort of connected me to the economic crisis that we're seeing here, especially in New York State. It's really been hit. We're talking about millions of Americans losing their jobs as well. In New York, especially with our lockdown, a lot of, the community is staying at home. People are laid off. There's a lot of concern going on in the community. Could you perhaps address onto the Brooklyn Borough's steps right now during this economic crisis?
It's really impacting people on a local level, the number of people who lost their jobs, unemployment, and we're calling on the city and state to do a moratorium on rent for the next 3 months, a 90-day period, mortgages and utilities, to allow the city to normalize itself. The ship is in turbulent waters, and we believe by taking one of the largest costs that's associated with homeowners and renters and their rent and mortgages, it would allow us to right-size the ship and allow people to sort of get back to a level of normality. If it's going to take 3 or 4 months, that is the amount of time we need to give the assistance to New Yorkers and people who are in the borough of Brooklyn.
Sir, any comments on the legislation bill that was passed by the Senate of the $2 trillion bill? I know your office had some comments on it too. There were some concerns about how it may not be enough for all of the work that has to be done. I would love to get your perspective on that, since we're talking about the economic crisis.
$2 trillion on a normal time appears to be a lot, but the amount of financial impact that this virus is causing, we may need more. And I'm hoping that the Senate and Congress will get back to Washington, D.C. if needed and infuse more cash on a local level. The one-time payment to families is something that we may have to extend. My office is going to come out with our version of a financial plan to see how do we find $10 billion in the New York City budget in the future. This is something that we're going to face. Now, keep in mind, after September 11th, we had a substantial budget deficit, and we look towards our real estate owners and raise taxes. But this time around, simply raising taxes on real estate companies, real estate holders is not going to be enough. We have to think beyond that and think in a big way of closing what could potentially be a $10 billion budget deficit.
So what do you see as the biggest hurdle for you when you are trying to determine that budget for your team, with your team right now? What's going to be the biggest issue or biggest concern in the hour?
Finding new capital, finding ways to put people back to work, finding ways of really organizing this city so it can function appropriately. I think that we need to use this opportunity to identify that our city cannot be caught flat-footed again. It's unfortunate. All across the globe, we knew that we were going to be dealing with superbugs and viruses. There's no reason we were caught flat-footed and not prepared to deal with some of the crises that we're facing now. It's now time for the country and cities all across America to start identifying how we would be prepared for the future. This is only round one. Scientists know that because of our overuse of antibiotic on meat and our overconsumption of meat, they know that we're going to be dealing with outbreaks like this many times in the future. And if we don't start preparing our countries and changing the way we're doing business, processing food, handling food items, and all those other things, this virus is presumably came out of Wuhan, China, because of some of the meat handling issues there.
Yes.
We need to start examining that.
For sure. And while we're talking about this, sir, another point that really comes up to mind, we're talking about the Brooklyn Borough right now, everyone. And today you tweeted that, the borough last night received about 1.2 million calls. Last week you received 7 million calls. That is a lot of calls for the Brooklyn Borough. Could you please, reflect more on that tweet? It showed that a lot of residents of Brooklyn are surely very, very concerned.
Those are probably citywide numbers throughout the city dealing with 911 calls. Those are calls when people are in need of emergency care. We are now looking at a way to utilize our 911 system more effectively. And I have been meeting with several businesses that are coming up with using technology more effectively and carrying out this plan.
For sure. And so, I want to sort of, we're coming towards a little close to the interview. So I would like to ask you a quick personal question. I know it's been a lot for you dealing with this entire crisis. You are traveling from one place to the other. You are addressing members of the community in all aspects. How has this experience been for you personally? And I know it's a lot of responsibility to be the Brooklyn Borough president right now. How are you dealing with it?
Remaining centered and grounded. I start my day meditating. I end my nights meditating. I eat a plant-based diet made out of high nutritional food. So not only must I be physically prepared for this, but I must be emotionally prepared. In addition to that, this is something that I did as a police officer. I was a lieutenant during September 11th. I know what it takes to cycle out of crises and tragedy. I spent 22 years responding to crises and tragedies that impacted this city during one of the most horrific parts of this city. And so this is something that I know. I'm not going to send nurses and doctors into harm's way. I'm not going to tell police officers and firefighters to be in harm's way and while I'm sitting at home. No, generals lead from the front. They don't send their troops into battle and ask how was the war. They're in front of the line, and I'm going to remain on the front line of this battle until every citizen is saved, or as many as possible is saved. This is what I knew as a police officer, and this is what I know as the borough president of a borough this large.
Sir, I have to say, I want to take this moment and just thank you for your service, and also thank you for your service during 9/11. I know that's something that impacts all of us as a community a lot, and a lot of those memories and that combat is sort of coming back. You just mentioned police officers. I would love for you to address the first responders and the police community. We're hearing about the numbers of cases increasing on all spectrums here in the police department. I know you called out on NYPD News staffing with all the first responders. You had some concerns about it. A little address on that, and your fellow policemen, I would love for you to give a message out to them.
The message is not only verbalizing a thank you, but actualizing a thank you by giving them the tools that they need to protect themselves and protect their families. We've learned from 9/11 when many of our officers were on that toxic pile, and some of them died immediately, others died a slow death as the years move forward, and some are still living with horrific illnesses that came from 9/11. I am committed to make sure that that never happens again. And so while I am in the streets, I'm going to continue to advocate for them and let them know I got their back because they have our back. And I thank them for what they're doing every day. And I'm going to show that thankfulness by being out here on the front line with them. They will never turn around and not see that I'm not there with them.
Yes, and that's so true. The first responders never turn around, and they've been a huge part of that. And the police has done so much in helping this community. Sir, while we are coming again to the close of this interview, I have to address you on your entire team, at the borough office. They've been communicating with us, giving us so much information. They've been telling us that, there's a lot of back and forth going on so that, the borough gets everything it needs for its residents. A quick message out to your team.
They're a great team. I'm extremely proud of them. Many people under this pressure will buckle under the fear, the anxiety, because we're all human beings. And just as we have a professional life, we also have a personal life. And, I'm a believer that if you have the fortunate to live long enough, you're going to have the misfortune to experience pain. The only question that lingers over us is how do we turn pain into purpose? And my team has shown that this is a purposeful moment, and we're going to rise to the occasion.
Sir, I got only 2 minutes left, and I have to ask you a quick question. And please forgive me if you didn't want to answer this right now. You are running for mayor, and that race is still on. Election is next year. Any comment? I know currently you're focused completely on COVID-19, but I would love for you to address just one statement on you running for mayor for next year for all of us watching.
Well, I think this is an opportunity. Out of crisis come real leadership. And the people of the city, they're watching. Where are their leaders, and who's going to deal with all that is going to come out of this virus? And being a mayor of a city of this diversity, you can't be just an accountant. You can't be a person that just can balance budget. Yes, we're going to have to come up with real ideas of dealing with the economic strife that we're facing, but we also need that lifelong experience of handling a crisis any day. This came out of nowhere, just as 9/11 crashed into our center of trade. COVID virus has crashed into the center of our existence. And that is what the type of 21st century mayor of the city of New York is going to have to expect and adjust to. And that is why I believe the individual this city is going to look forward to is going to navigate us out of these terrible waters. And that is why I want to be the mayor of the city of New York.
And thank you so much for saying that and sharing that with us. I truly appreciate your time and effort, sir. And thank you again for being on the front line. It is so essential. Your one last message for dear New York.
New York, no matter how challenging it is, no matter how difficult it is, we're going to get through this. We're going to get through this together. Let's just stay strong, and let's show people, the entire globe, strong, we stand strong, and we will get through this.
Thank you so much for being with us here on Skype, sir. Thank you so much for your time, and good luck to you in delivering those packages. I'm so excited.
Thank you.
Thank you so much. And that was none other than Brooklyn Borough President Erik Adams. We hope you enjoyed this live segment. Stay tuned on to ITV Gold for so much more of our voice and your voice. And that was none other than Brooklyn Borough President Erik Adams joining us live. Thank you so much for joining us on ITV Gold. I'm Aditi Lamba signing off.